So, this is Dr. Janelle OD, your eye care expert. We are here today doing our eye spa talk. And I do apologize if you see a bit of a delay. I have not figured out why my screen is delayed, but we're going live today. So, I'm going to introduce myself. For those of you who do not know, I'm Dr. Janelle OD, your eye care expert, the founder and CEO of Braynott's Vision Center and Premier Eye Spa. And we've started Eye Spa Talk Tales from the Trenches. This is our second episode, and today I'm excited to have a special guest here with us. We have Desiree here today. She works with the company that I've been working with now for a couple years, and we're going to talk about some new products that they're going to be bringing to the market, as well as some of the products that they currently have and that we offer to our patients. So I'm going to give Desiree a chance to introduce herself. And while she's doing that, don't forget sharing is caring. So at the bottom of your screen, you should see a button in the left-hand corner of your Facebook screen to go ahead and share that so that other people can see this information that you're getting. And you can pass this on to your family members and friends. And then also don't forget to put any comments or questions. If you know me, you can text me and I'll try to get those answered in the midst of our broadcast today. We try not to keep you too long. We don't plan to be here past 7:30. So let's give Desiree a chance to introduce herself. Hey, Desiree.
Hey, Dr. Davison. My name is Desiree, and I work for a company based out of Jacksonville, Florida called Doctor's Optimal Formula. We have several umbrella companies underneath Doctor's Optimal Formula, and I have a little bit of involvement with all of them, but mostly I work with Doctor's Optimal Formula, Allergy, and our newest company, which is Ocular Skincare. And we are developed by eye doctors for eye doctors and their patients.
And that's what I love about it. You were developed by eye doctors for eye doctors. I think I met Dr. Loft. I think it was back in 2017, 2016. I actually came out to your facility. I was there for a big conference with some other doctors in the Florida area. And I remember touring the facility and I was like super impressed and excited that this is all for eye doctors by eye doctors. So tell us a little bit about the facility.
So the facility is also based out in Jacksonville, Florida. We're about 4 to 5 miles away from Jacksonville Beach. And we do all of our own manufacturing. So we purchase all of our raw materials for every product in our manufacturing facility. We do all of the manufacturing from start to finish, and that includes the testing, the bottling, the labeling. We're able to actually private label almost everything that comes through our facility because we do our labeling on site, and then we ship direct to providers.
So that's awesome. But I like that it's made in the USA. So it's
Yeah.
right here in our own backyard. It's what makes it special too, as well, which we're going to have you talk about a little bit more, that many of the things that are formulated are natural. They're
Yes.
Dr. Loft finds a natural or holistic way to help with a host of different conditions that patients may suffer from. I'll go into a little bit about some of the things that I do prescribe for my patients, but speak a little bit about on the holistic, the natural aspect of Doctor's Optimal Formula.
So, like you said, Dr. Loft does source all of his ingredients and all of our raw materials naturally. One of my favorite products that we have, and I think that it's one of our best performing products, is our glaucoma support formula, which is sourced from all natural ingredients like pine bark, peak noginol, and it's ultimately made into mertaginol. And what's really cool about that product is that it's been shown to potentiate latanoprost, which is phenomenal.
Yes, definitely. That's one of the products that I use and I like a lot in my practice. It's really great for patients who are looking for alternatives. You know, patients like to have a doctor who
Mhm.
is versed in alternative and therapies that you can use adjunct with other, let's say, more non-traditional or man-made medicine. So I have patients that I may start off on some of the supplements and then couple with a drop if needed. But
Right.
patients really do appreciate the fact that I am versed and I'm aware and I'm willing to be able to try these things. And then there's research. I've read articles. There's research. It's proven peer-reviewed articles that this pycnogenol works well to help minimize pressure or lower the pressure. And it works very well in conjunction with a prostaglandin or latanoprost to be specific. So that's one thing I really like about the company, but it doesn't stop with glaucoma. There are anti-aging formulas, which I have here. I like to show people the bottle. What I like about it is comes in this very nice bottle that is not confusing to the patients. I have a lot of go over the counter purchase things. And sometimes, even if it's a simple omega-3 that I recommend, I prefer to have it from someplace that I've vetted. I
Right.
know what's in it. I know the steps that are taken to make sure what you're getting is quality and pure. So a lot of times patients want to be healthy and holistic, and they're taking things that are recommended by their friends. But a lot of times you're just taking them and it's not being absorbed by the body because it's
Right.
nothing that's really designed for the body. So, talk about the anti-aging formula that you guys have. It's a capsule, it's a veggie capsule, and it has a lot of natural blends and a proprietary blend that was, I guess, made by Dr. Loft. I know it's a secret blend, but speak a little bit about your anti-aging supplement that you have as well.
So the anti-aging supplement, the actual key ingredient in that is the PQQ, which is very expensive. And that's one of the things I love about working with holistic products, because a lot of times people will equate how much something costs with quality.
Hmm.
And that's one of the things I love about the anti-aging formula, because it costs us about $20,000 to make one batch of that formula. But we're able to sell it to patients to where that they can afford it,
Hmm.
and they get the true benefits from the anti-aging. That formula is absolutely amazing. My husband actually takes it himself. He's a young guy, but he's started going gray about a year ago. He started taking the formula, and within the first 3 bottles, he's had a big change in the hair follicle and the thickness of his hair. It's a really great product.
Yes, and then I noticed in here there is some biotin that helps with the hair
Yeah,
follicle, hair,
that
skin, and
yeah.
nails. So, and then I like the packaging of the product. That definitely helps the patients to understand that this is something that's definitely formulated, recommended by your doctor. You're not going to be able to find this everywhere. You have to be guided with this product. So, does most, if not all, of the products that are recommended by a doctor going to be in this kind of packaging?
Yes, all of our products come in packaging like that, because we package it that way so that patients do understand this is something that needs, this is a treatment plan. This isn't something that you're going to take for a month and your dry eyes are going to go away, or your blood insulin level is going to be right where it needs to be for the rest of your life. This is a treatment plan that you're investing in, and then you have to continue this on, and it does need to be guided by a doctor.
Definitely, and that's what I like about that, and I think this is a great company for doctors to work with to be able to provide those options for their patients. Now, you
Yeah.
did say glucose levels, so you guys also do have a formula for to manage and monitor glucose levels for
Yes.
diabetes.
Mhm.
You want to speak on that a little bit?
So our diabetic formula is actually in kind of a league of its own, and it's one of our only formulas that has a really good mixture of like Indian medicine and Chinese medicine. So there are a lot of ingredients in there that you'll see and you'll recognize, like, oh, I've had that in a dish in an Indian
Mm.
restaurant, or maybe that was in a dish at a Chinese restaurant. But we're able to blend those two ingredients together, and we're able to make a really great formula that can address insulin level and can help your body process carbs properly.
Definitely. That's one of the products that I like as well. There's an array of products I like, but I like the fact that it's an array of different options available for doctors to have these conversations with their patients, and patients to feel comfortable to have alternatives. And a lot of times it's not a solo. A lot of times it's in conjunction with some of
Yes.
the medicines that you're taking to help balance things, and with the goal eventually be able to have maybe more of a more natural way to maintain things. But like I said, patients definitely like the fact that a doctor is versed and is willing to have those conversations with them. So
Right.
we're going to pivot just a little bit because I want to get into the new product that you guys are going to be launching. We want to talk about that a little bit.
Sure.
Um, Before we get into that, I do want to talk about, because we're here in Georgia. I'm not sure how bad the allergies are in Florida, but they're horrible here. This year, it's been a little better because of COVID-19. A lot of people were indoors and weren't
Yeah.
outside as much. I'm still having patients coming in now, particularly in June, when things will start to lag off with allergy symptoms and issues because now they're getting back outside more. So you guys have an allergy formula as well that is a oral medication or oral supplement that you take,
Right.
and then now you have a topical drop that does not have the antihistamine in it, which is really good for patients who have ocular surface disease, and that's going to minimize dry eye issues associated with that. So let's talk about those things a little bit.
So our allergy formula is, I don't think there's anything like it. And I like to refer to both of those, our allergy formula, which is a capsule, and then we have a drop, which is a topical drop. That is actually under our Allereve brand. It is branded Allereve. Those products contain, the key ingredient in them is butterbur. And butterbur, it does a really great job of addressing allergies. But as you said, every patient who has ocular allergies, or at least half of them, we know studies show that they have dry eye. So what happens when you're addressing with current therapies is you're addressing those allergies with antihistamines, which dry out your body even more, which exacerbate the dry eye symptoms. So we're able to address the ocular allergy component with our allergy supplement and the topical drop without worsening dry eye symptoms for patients. So that, to me, that is something that there's nothing like that on the market.
Yeah, and that's a win-win. Because we always say which came first, chicken or the egg, dry eye,
Right.
allergies, dry eye, because they kind of go hand in hand. If your eye is not able to stay hydrated and work properly, you're not going to be able to defend off allergens and things that you're exposed to in the environment. And so when we prescribe for those, sometimes we kind of exacerbate things that we're trying to treat with dry eye. So it's definitely helpful to have an option that is a natural-based option as well to minimize those symptoms. And the allergy formula orally works very well. I have some colleagues who actually take that formula, and that's how I found out about it.
Yeah, I take it.
They take it, yeah, because they have bad allergies. I have a colleague in Alabama that takes it. Question about the allergy formula: is there an age minimum for that?
No, there's not an age minimum for the allergy formula. In fact, it can even be helpful for my niece. She's 14 years old and she has migraines, but
Okay,
they're induced from allergies. So she
okay, yes.
takes the allergy formula to address those ocular migraines.
Yes, and then good point. Migraines usually have trigger factors. So a lot of things, environmental, uncorrected prescription, a lot of those things can trigger your migraine. So it's important to check those boxes off. So especially as a child, if you can help them check those boxes off with something that's a natural basis, it's a win-win. So the Allereve is really, I'm really excited about this product. It's a drop. And we have patients who are taking eye drops to help stimulate tears or eye drops to reduce inflammation on the front surface of the eye for other ocular surface issues associated with dry eye, but then they have allergies too. So it really helps that we can prescribe something for them that won't exacerbate those issues. And so since Allereve has been really good about that, Dr. Loft is really, have foresight to see that this can benefit in other areas. So this brings us to Ocular, which is a new skincare product, aesthetics. And back up a little bit, you may be thinking, well, why does Dr. Davidson care about aesthetics? Well, ocular aesthetics, I have an eye spa. So in our eye spa, we deal a lot with advanced treatment for dry eye, but we also look into aesthetics and anti-aging. We have a licensed esthetician that works with us as well. And so to find out about a product, this kind of product coming to the market, is definitely something that fits into that space because we want to be able to have those conversations with our patients, but to make sure that we're not going to exacerbate any dry eye. So tell us a little bit about Ocular.
So Ocular is a brand new product, and we're still working on the marketing. It's so fresh, it's so new, but we've decided, hey, we have a skincare line. We've always had a skincare line, and we're like, wait a minute, we've got Allereve over here. What if we were to infuse our skincare line with Allereve? And that's what we did. And what's really great about that is we're able to address the skin all over the face, but particularly around the eyes, where patients who have ocular allergies, dry eye symptoms, a lot of times are hiding behind their sunglasses because their lids are puffy or they're scaly or they're the dark circles.
Mm-hmm.
So we're going to be able to address that. And a lot of the products that we have, you can use them all over the face, which means that their skin is absorbing it and it can address inflammation, it can address bacteria, toxins. They can inhale, so to speak,
Mm-hmm.
almost like a Vicks vapor rub. They can inhale the face cream and it will address the allergies nasally. It's really awesome.
So this seems like it's going to be a very great product. This space of having products for aesthetics and beauty that don't exacerbate other conditions on the
Mhm.
ocular surface that your doctor may be treating, your eye doctor may be treating is important because we've had new makeup lines come out. I think it's believed the eyes are the story based for some optometrists that have come up with mascara and different makeup things that don't exacerbate dry eye. So definitely having a skincare product because we put a lot of different products on our face and I was just doing a lot of lectures. Webinars are the thing to do now. I've been up sometimes to 10:30 at night on webinars. But I was on a webinar that had a whole 2 hours talking about the beauty industry and eye care and how things that we do and me, I'm doing my creams because I'm trying to prevent all the
Right.
wrinkles and all the good stuff, but not realizing that those things may be setting off some of my dry eye or other issues that I've had. And that now as eye doctors, we need to turn around and start looking at those bottles and have those conversations with our patients so not to say they can't do it or scare them, but we can
Right.
guide them and have an educated conversation with them, and then to send them some places where it's going to help with those things. So I'm very, very excited about this product. Now, tell me a little.
And
Go
I'm
ahead.
one of those patients too. I love the lashes. I love faux lashes. I have worn them for probably a year straight up until the coronavirus situation where
Hmm.
I've really backed off of going into the salons because I do work in healthcare. I do work in a manufacturing facility. But I'm walking around with and the eyelashes and I know I've got blepharitis and I've got
Hmm.
MGD. So I'm really excited about this. And I want to tell you because you do have a salon there for lashes that we're going to be able to develop a face wash that will be safe for the faux lashes. So it'll be oil free. Patients can use it on those lashes that they love so much that they've spent a ton of money on to maintain,
Exactly.
and it won't make them shed, and it'll actually address the blepharitis and the MGD and the swelling of the lids.
Now that's important. Everybody has their kind of different stance on, they call it beauty and the beast, or eye care, beauty at what expense, but I like to look good. I like to do
Yeah,
all of those
I'm,
things.
I'm right
And
there with you.
just like anything else, and not saying that if you don't, that you don't look good. I'm not trying to knock anybody else, but I'm a girly girl. I've always been. I have an 8-year-old daughter who I believe is worse than me, so pray for me. But I like to do those things, but I want to make sure that I'm not potentially causing any harm. I know the pros and cons, and it's more doing it educated and guided. And
And
so if
doing it
I
the
had
right way.
yeah, and if I had a doctor growing up, that my eye doctor I could go to, that I could talk to her or him about mascaras and shadows and creams and things that I normally do that I can do without causing any potential long-term issues with my eyes or exacerbating my dry eye, I mean, that would have been just a win-win situation for me. So I have these conversations because I don't want to scare anybody into not doing anything. A lot of it is just education and moderation. So the more you know, the better you do, and then to know that there are doctors out there that are in this space that you can have those conversations with outside of asking about your glasses or contact lenses. So and working with companies like this is awesome. Now, how long has Doctor's Optimal Formula been around?
So Doctor's Optimal Formula has actually been around since the early 2000s.
Okay.
Doctor's Optimal Formula is completely physician exclusive, and we do not market direct to consumer, or direct to patient. And we don't do that because we want to protect our doctor network and make sure they're the only people talking to their patients about products. So patients don't come direct to us to buy products. They have to go through a doctor. And if
Okay.
they want to be able to find our products, they can either ask their doctor about it. And if the doctor isn't sure what Doctor's Optimal Formula is, the patient can go to doctorsoptimalformula.com and say, hey, I really would like to work with your products. Can you reach out to my doctor about signing up for an account so that I can work with your products?
And yeah, that was going to be my next question because I know in my practice, I work with you guys. And so we have these awesome prescription pads with the code. So
Yeah.
therefore, we can make recommendations for patients and then they could go onto the site or they can call. But then the code lets them know what doctor is having these conversations. And then these are shipped to them. And patients love it, especially the glaucoma support, the different things that we recommend, and they know what's in it. It has all the ingredients and everything in it. And what I like too, that most, even the ones I'm looking at, they're veggie capsules, which is really good
Yes.
for individuals who have that as a concern. And I'm going to open it up here. It's not too big. They're pretty easy to swallow. Now, with any supplement, you should take these with a meal, right?
That's right. With a meal. What's really nice about these capsules too, we do have some formulas that are still in the gelatin capsule, but we are moving everything over to veggie cap.
Okay.
It's just one of those things where when you're manufacturing, you go through the materials that you have, and then once they're gone, you move over to the veggie cap. So that's what we're doing. But if you have a patient who's unable to swallow capsules, you can actually empty the capsule into a juice or peanut butter or whatever, yogurt, oatmeal, and the patient can consume it that way.
Oh, wow. That's awesome. That's good to know because I have some patients, even I used to be one of those patients that couldn't swallow
Yeah.
pill. My life depended on it. I've gotten better, but that's definitely good to know because some patients, they're apprehensive about taking things. But with these capsules, they go down pretty easily. And
Yeah,
I
they
have
do.
only
They
used
really
them.
do.
So I always like to kind of give, I'm always believe in girl power. So I always like to give young girls a space or to learn about other career options. So I want you to talk about your background a little bit. You're a licensed dispensing optician. So talk about that a little bit, especially if there's any preteens or young women listening and like, wow, I never thought about this type of career, and you can end up in a medical processing facility. So talk about your background a little bit.
Yeah, absolutely. So I'll actually start off by saying that I was actually a teenage mom. So I started out, I had my daughter when I was 17 years old, and I was like scrambling, trying to finish my dual enrollment. I was in high school, but also partly in college. And, I didn't want to be a statistic. So I was like, okay, what am
Exactly.
I going to do with my life? Like, what am I going to do to make sure that I'm not a statistic or my daughter's not a statistic when she grows up? So I kind of rolled into the eye care industry when I was 18 years old. And I started out in a private practice in Gainesville, not far from the University of Florida. And I worked there for many, many years. I ended up becoming a licensed optician. And I love the clinic and I miss the clinic every day. But I kind of got into this mindset of what can I do outside of the clinic? Like, what can I do that follows the patient home? So then I got involved in optical dispensing consulting. So, and I did that for a long time. And I managed about 60 ophthalmology clinics from Miami to Long Island, New York. So I was
Oh,
kind of
wow.
flying back and forth for many years. And then I was like, okay, yeah, but I still want to be involved past the eyeglasses. I
Hmm.
want to know what's happening with the patient once they go home. What's the treatment plan? So then that's how I kind of landed in nutraceuticals, and I just kind of rolled with the punches ever since. And I tell you, I really love working with the nutraceuticals. We do nutraceuticals for macular degeneration, diabetes, glaucoma, anti-aging, but we specialize in ocular allergies and dry eye. So we have lid scrubs, lid sprays, eyelash serums. I mean,
Yes.
you name an interest in a product, Doctor's Optimal Formula has it.
Yes, the serums. I forgot to talk about that with the serums, and then the puffy eyelids underneath. It's funny. I use that at night, and I tell my patients about it. And they go, "But well, your eyes are not puffy," and I'm like, "Because I do stuff.
Yeah,
Because that's why they're not puffy."
yeah, I
But
love the
I
product
love
too.
the wake up serum, and I like how everything is natural. The eyelash serum. My sister uses that as well, and it has castor oil in it, lavender oil. I mean, everything is just so natural. And I tell
Yeah,
patients about it, like, ooh. So you don't kind of feel so guilty about enhancing your beauty, and you know that you're not causing significant harm to yourself. And then the fact that you were able to have that conversation with your doctor is amazing. But your story is amazing. I didn't even know that. Just talking to you, I know you're a wealth of knowledge. I know the company through you. I've met Dr. Loft before a couple years ago, but everything that I've learned about the products and how awesome the company is through you. I mean, you're a wealth of knowledge, and I
hey,
appreciate you
thank
sharing your
you.
story, and that's very inspirational. You're right. Certain things or certain pathways don't have to be a dead end. It's
Right.
perseverance and just knowing that you have more to give and you want to give more. And I mean, you're doing an awesome job, and I've learned a lot just I'm emailing you all the time. I'm like, Desiree, where do I get this? Desiree, what do I do with this? So I'm sorry, I'm an emailer. So if I get on
No,
your
that's
nerves, just
completely okay. I think that it's very important to learn something every day, no matter what. No matter where you are in your life, no matter what your career is, it's important to learn something every day, even if it's this big. It's
hmm.
so important.
Yeah, I definitely agree. I'm always reading magazines, just trying to expand my knowledge base. And always my part of my theme here is, and the reason why I do a lot of these things for patients, as far as education, because I like the more you know, the better you do. So sometimes if
That's
you
right.
just didn't know and you were ignorant, then your decisions may be different. But if you know more, then you sometimes can make better decisions. So
Right.
that's why I have these platforms so that women can make better decisions about their ocular beauty enhancements and aesthetics, and not feel shame or scared, but no, I can do this. And my doctor's recommended this, and this is better than what's recommended in the mom's group on Facebook, because my doctor recommended it and why.
Or
those
those dry eye groups on Facebook.
exactly that are not administered by any doctors, just somebody who's suffering from dry eye disease. So you
Yeah.
can get in a lot of groups, support groups nowadays, but then you have to be very conscious about where you get your information. So Ocular, when does it hit the market?
So Oculair's launch date, we're hoping for August 1st. We're working on all the marketing right now. We've got some really nice stuff put together. It's just a matter of fine tuning and making sure all of our marketing looks the way we want it to. But we're looking to launch 9 to 10 SKUs August 1st.
August 1st, yes. And so
Mhm.
I think you mentioned there's going to be the serum, there's going to be the under eye cream, there's going to be the facial cream. And so all of these things are going to be available in my spa. I can't wait because August, my practice is relocating. And so I'm really going to put a bigger emphasis on my eye spa. It's going to be on my marquee and everything. And so I'm excited to have this product that's going to be available in our spa, and our estheticians are going to be recommending it for our clients and our patients that come out of there. And I'll feel comfortable for my dry eye patients that they're getting these services, which they do, guided under me. They get lashes and things once we get everything nice and controlled. And I put them on a treatment plan. So adding those aesthetic services as part of their treatment plan, so that way they can do those things and feel good about themselves, but not feel guilty at the same time.
That's right.
So I'm going to see if there's a few questions here. So I'm always looking, I kind of look on my phone at the same time because I'm still trying to figure out how to get questions and things at the same time. One question is, I know there isn't an age minimum, but is there a point that it's too late to do anti-aging? So what if you're like in your 60s and you will say, you know, you want to start taking an anti-aging tablet? Is there a cutoff where it's like, okay, you should have started this earlier?
No, it's never too late. It's never too late, but you have to have realistic expectations. So just your patients have to have that in mind. Any patient has to have that in mind. Also, there's a lot of great off-label benefits for some of these products, like the anti-aging product. There is some restless leg benefits to that
Yes.
product. So it's, as a provider and me as a representative for the company, it's very important that I educate my providers like, hey, these are the other things that these products can address.
Yeah,
So that when
definitely.
you're speaking to the patient, if they're feeling like, oh, that's probably not going to help me, I bet you there's an ingredient in that bottle that will help them with something in their life.
Yeah, definitely. So, like for instance, if you recommend omega 3s for dry eye to help with inflammation, you get the added benefit of joints. So I've had patients come back
Right.
and say, "Yeah, you helped my dry eye, but I'm doing squats, and I wasn't doing those before." I had a lady just break out and start doing squats in the exam room. She said, "I
Yeah.
couldn't do that before." So yes, most things, especially if it is a natural supplement, you're going to get other added benefits throughout the body for taking those things. So that's a good point. I have a lot of patients who kind of fall into that demographic, and they may think it's too late, or they're trying to regain their youth, but there'll be other things that you'll be benefiting. And you know, you may see some improvement with taking these supplements and things that are recommended.
Yeah, I've had
Um,
patients who actually have benefited from the omegas, hair, skin, and nails, but
yes,
also periodontal, Sjogren's, arthritis, multiple sclerosis, all
yes,
kinds of different things that omegas can assist with. So it's never too late. You just have
definitely.
to have pointed, realistic expectations.
And taking a quality product. So a
Yes.
lot of times I say see patients, they have very good intentions. They are taking all these different supplements and vitamins, but you know, have to be conscious of where you purchase these things. What I do like about these products that there are a good sliding scale, they're affordable, but usually I say if it's too good to be true, then it's probably not true. Like if it's
Not
super
true. Yeah.
inexpensive or really cheap, usually things that are going to be doctor formulated, doctor recommended, there's a lot of times there's extra steps that are taken to make sure that those products have the quality that they need and it can be absorbed by the body. So sometimes it's going to be reflected in the cost. So I try to educate patients on that with these type of things, and with beauty, I always believe in don't nickel and dime beauty. If you got a nickel and
Right.
dime it, then just stick to, just don't just be natural, because if you're going to put things on your face, on your eyes, whatever, that's one thing you don't want to nickel and dime, is what I tell my patients. So
Yeah, that's right.
and let's see if we got to keep other questions. Okay, so just like I say, there's not any few other questions, but usually if you have any other questions, this is usually recorded and I'll send this on my various different platforms. If you have any questions that you were afraid to ask, you can always email me at icare@drjanelleod.com. I'm going to be back here next Sunday at 7 p.m. and we have a special guest again next Sunday. We have Dr. Briscoe out of Hollywood Eyes in California. We're going to be talking about Beauty and the Beast. So we're going to have these talks about skincare, eye care, and in the midst of COVID-19. So normally right now, Desiree and I are looking really good, but guess what? We don't have a mask on. Normally during the day, I can't at work. I'm like, I can't put my lipstick and stuff on. My mask is irritating my face. So Dr. Briscoe and I are going to talk about in the midst of this beast, how can we look good in the COVID-19? So we're going to talk about that next week. I want to thank you, Desiree, for taking time out of your Sunday evening. You're in Florida, so I'm sure there's plenty of things that you could have been doing to enjoy the.
Oh, thank you so much for having me. I really appreciate it.
Thank you. And then patients, if you're listening, ocular is going to be available August 1st. We'll have that in our office. These other products are already available. We've already been prescribing and recommended for patients. When you come in, I'm usually evaluating. If I see something that you can benefit from, I'm gonna let you know about it anyway. But if you see something or you have a concern, bring it up, because there may be an option for you that is more natural, holistic base for us to help with some of your concerns. I want everybody to enjoy the rest of your evening. This is Dr. Janelle OD, your eye care expert. Thank you for joining me today on I Spy Talk, the Tales from the Trenches. Have a good evening.